Welcome to Kitchen Table Conversations, a series of short and shareable conversation starters for those of us who have or love and support people with a complicated and beautiful brain. Here's your host, Angela Geddes.
Hi, and welcome to another edition of Kitchen Table Conversations. I'm your host, Angela. And once again, thanks so much for tuning in today. Thanks so much for your interest in these conversations. Thanks so much for sharing them amongst your own circles. I'm just really grateful and quite honored that I'm able to do this. So as many of you may know, September is International FASD Awareness Month, and September 9th is FASD Awareness Day. And so throughout the day, there will be a variety of opportunities for all of us in one way or another to play a role in terms of prevention and to do our part to make sure that all pregnancies within our close personal circles or within our professional circles or within our communities can be as healthy as they can be. And that comes from a really clear, compassionate, and evidence-based messaging. So today's conversation is going to circle around that. We're now kind of ending the beautiful month of August and rolling into September. So I kind of want to keep this conversation going. I think I owe it to our communities to do as much as we can this time of year. And as you know, always, right? It's always really important to do whatever we can in terms of prevention. So in the realm of some of our prevention efforts, especially regarding prenatal health, it's kind of easy to get feeling a little bit disheartened by some of the mixed messaging that continues to come from media. And unfortunately, also, it continues to come through our medical field. Despite the very clear evidence that there is no safe amount, no safe type, or no safe time to consume alcohol during pregnancy, it may come as quite a surprise to many of you that we are actually continuing to see increasing rates of drinking among expectant moms. Again, this is because of some of the mixed messaging out there. I have heard myself countless stories where physicians have dismissed the risks associated with alcohol use in pregnancy. In my own circle, I have heard people say to me things like, "Oh, come on, it can't be that bad, Ange. Our mothers all drank and we're all fine." And my response to that is usually something along this line. First of all, my mom did not drink alcohol at the time, so that was not something that impacted my development. However, as many people did back then, she did smoke cigarettes. So we're seeing a link between cigarette smoking and ADHD, and I'm not diagnosed, but I may have a trait or two. How do we define fine? That's another thing. So I think that it is really important to note that, I see people in my personal circle, in my neighborhood. I once had a really interesting conversation with somebody that came into my home to do a little bit of work where, we got talking about what I do for a living, and it didn't take long to talk about FASD and the role of prenatal alcohol exposure and the link to, puzzling mental health and sometimes some school and social difficulties. So within, 15 minutes of that conversation, we had determined that there were 11 people in her circle, all of which had been exposed to varying degrees of alcohol during the pregnancy, and all of them were experiencing some level of mental health or, some sort of learning difficulty. So again, I see people in our neighborhoods and with our friends and extended family members who are very bright, very creative, often very musically talented, very hardworking, very tenacious, and very loving and compassionate and inclusive, who also struggle with relationships, with stress and anger management at times, and maybe learning new things or adapting to change can be difficult, many of whom involve themselves in some risk-taking behavior. Sometimes following through with their plans or their goals or keeping focused on things remains difficult for some. We also know people who have a hard time developing new routines, or maybe they over or undereat, maybe they overdrink, maybe they have some pretty rigid ideals and some thought processes, and maybe they're vulnerable and easily influenced. And maybe some of the kids or the people that we know in our circles can be very impulsive and have a tendency to overthink. Maybe you're a little bit sensitive to touch or to in their environment, whether it's lights or sounds. And oftentimes there's kind of an inconsistent performance that we see with people in our circle, maybe some unexplained fears, and maybe some people who really struggle with low mood, anxiety, and some other social quirks, all of which we just sort of think, okay, that's what comes with this person. And if they only did this, maybe they would improve. If their parents only did this, maybe they'd have a better chance. I see it all the time where parents are blamed for kids' misbehavior or challenging behaviors or moods or attitudes while at school in particular. And so many people, just kind of are forever sort of saying that parents are just not doing enough and the kids are spoiled, that kind of thing. So, and unfortunately, there legitimately are a lot of overlapping characteristics with several mental health conditions with some of the symptoms that we're seeing here that result from prenatal alcohol exposure. So it's really difficult to tease out what exactly is happening and what may be the root cause. But I can tell you with certainty, however, that prenatal alcohol exposure rarely gets considered in any kind of assessment or treatment plans. Yet it is so often very directly linked to many mental health conditions, and it is the leading cause of learning and developmental disabilities in the Western world. And with the right information and the proper supports and a compassionate approach, this can be prevented. So it can't always be prevented, but it can in many cases, again, with the proper supports and with the proper information that's, evidence-informed and very clear. So let's think about this for a minute. This is the leading cause of developmental disabilities, and there is a chance for this developmental disability to be prevented. The consequences are so enormous for so many. It comes with lifelong, puzzling, and extreme challenges that are emotionally and fiscally very consequential. I do understand the stigma associated with mental health, and I know that it's real, and I know that it continues despite our best efforts, and I do know that there's progress being made, but let's be realistic, we have a long way to go. There's still so much hesitancy when it comes to, we're talking about it in the media, we're talking about it, there's lots of campaigns to help reduce the stigma, but when somebody's struggling with a mental health condition, do they really want to tell their boss about it? Do they really want to tell their coworkers and ask for extra help or special accommodations? We still have a very long way to go. I see it in my practice on the daily. I also understand that the stigma associated with alcohol use, and especially during pregnancy, is also very real and a little more pointed and maybe a little more impactful on all family members involved. However, I do not understand why we as a society are not willing to take this information and believe it. And I mean really believe it. Believe that alcohol does some irreparable damage and interferes with the development of our babies. We are seeing a mental health crisis. Everybody knows it. We are seeing a crisis in child protection services and in communities where there has been historical trauma and poverty. They're hit harder. We are seeing a housing crisis, and our justice system is not currently set up to address the complexities of this hidden disability as well as it could. And FASD is overrepresented in all of these systems and more. Not because we don't want to be helpful, not because we don't care, not because we aren't absolutely doing our best. We all want to improve life circumstances for some of our most vulnerable, but we simply can't offer support in the same way to people who have these hidden and complex disabilities and expect different results. We can't offer the same kinds of mental health services when we're not experiencing the same kind of mental health issues. So when the treatment plans do not work, we must dig a little deeper. And when we do, we often find hidden brain-based complexities, and some of which are directly related to prenatal alcohol exposures. So tell me, or help me to understand, why aren't these messages going viral? Why are these not being better received? And why are we not more interested in supporting ourselves and each other as we, move along with this family planning and make decisions around our own families and around the families that we support. So, in terms of fiscal responsibility, doesn't it make sense to reduce the numbers who need these health and social welfare services? Doesn't it make sense to prevent lifelong unnecessary challenges for everyone? Doesn't it make sense to ensure that pregnancies are as healthy as they possibly can be? As my oldest son once said, you're building a baby. Why would we put anything in our body that's not proven to be helpful, and certainly that is proven to be potentially, toxic and really quite dangerous? So why would we put anything in our bodies that aren't going to really help the growing baby reach its potential? So on a brighter side, every so often, a reminder comes along that reinforces the impact of our prevention efforts and helps me to understand that I am doing exactly what it is I'm meant to be doing. And honestly, I can't imagine any more meaningful work or efforts put forward. But recently, during a conversation with my sister, I can remember sharing my frustration about some of the resistance to the prevention messaging, and some in particular where some people were calling our messaging patriarchal and implying that it's a women's right to choose around whether or not they want to consume alcohol. And I just, I really, really struggle with that, because I think that the women who are talking here, if they followed me around for a half an hour, they would know that it's not their right to choose to drink alcohol. And I need to be clear that many people consume alcohol for a variety of reasons, and none of which are there to intentionally harm their babies. People do struggle with addictions. People do struggle with domestic violence and all kinds of life circumstances that make not drinking nearly impossible, and if not impossible, without real wraparound and compassionate support. So I'm not here to make unhealthy judgments, but I am here to say that if people followed me around for a little bit, and I have heard directly from biological moms who have told me, why didn't somebody tell me? If only somebody could have given me that information and made it very clear to me. And if somebody could have held me in a home or took me away from that environment, I would do anything to turn back the clock and make sure that I didn't consume any substances. I needed help and I wasn't able to get it, and I really wish I could have. So I hear directly from everyone, people who have biological family members. I have heard from foster families. I've heard from people who are working in the field, grandparents, kinship arrangements, and I certainly hear every day from individuals who experience the impact firsthand. So again, I'm not here to make judgments, but I am here to share clear and pointed information so that everyone who listens to this has an opportunity to make an informed decision. So again, I was feeling a little bit frustrated. I was having a conversation with my sister about some of the resistance and the permissive approach that many physicians, or even some of the pregnancy applications out there offer some of our folks. And she was so kind to reassure me that my efforts have in fact made a difference. She then shared a story that actually just filled my heart with hope. And so she shared with me that her daughter, my niece, Stephanie, was very careful to plan her pregnancy and was influenced in part by our discussions that have taken place around our kitchen tables for years. Since the kids were very little, my kids in particular have become FASD experts, whether they wanted to or not. But as a result of that and the clear messaging that came from me, Stephanie chose to go alcohol-free even before conception and throughout her entire pregnancy. She acknowledged a lot of mixed messaging being shared, which could be confusing for many, and she knows that some in her circle too have been unclear about what the safe amount might be. And she also reached out to me for more information about the risks of alcohol use while breastfeeding, because again, there's a lot of misinformation being shared in this area as well. So although she understands that alcohol can technically be consumed safely if timed absolutely properly while breastfeeding, she has decided to avoid it altogether. She cannot trust that her baby may not need, in the middle of her, scheduled feedings, maybe another top up or something like that. So she is choosing to remain alcohol free, and she just doesn't want to take any risks at all. I say yay for her, and how things have changed. So when our oldest nephew was born 32 years ago, for example, in the London hospital, literally the nurses brought a beer to new mothers thinking that it was going to help with milk production and letting the milk down and easing with that breastfeeding experiences. So we only know what we know. And when we know better, we can do better. So that's the purpose of this. So in a world full of so many uncertainties, I just think I want to give a little shout out to Stephanie and Brent in particular, who made a distinct effort to ensure that their baby, Mr. Miller Moore, was given every opportunity to reach his developmental potential by avoiding all prenatal substance exposure. I'm thrilled to announce or to introduce to you Mr. Miller. So please check out my website for some pics and some research articles on these topics that can help clear anything up for you in particular. And certainly while you're having conversations amongst your circles, you can reference those. So again, while we can't guarantee anything in life, we can celebrate the choices that give our children the best possible start. And I might be a little biased, but I think that Miller is just about perfect. And I am deeply grateful that I may have played an even small role in this beautiful story. Kind of brings a tear to my eye. So please bring this story back to your kitchen table, because clearly our typical prevention efforts are not working as they should. We have to keep talking. We have to be creative with our messaging, making sure to be clear, compassionate, and work towards reducing the stigma associated with this. There are many reasons, again, why people drink. And I do believe that when we know better, we can do better. With many thanks, Angela.